Hello, I'm Dr. Bill Lyndon. I work in the Mood Disorders Unit at Northside Clinic, and I'm the Medical Director of the ECT services here. Today I'm going to talk about depression. The diagnosis is very dependent on what symptoms the patient presents with. In other words, the patient gives us the diagnosis by telling us how they feel. We don't have a blood test or an X-ray or a scan that will actually give us the diagnosis, and that's one of the things that makes psychiatric practice a little more difficult. And to be able to identify clinical depression is very much a clinical skill, and so it's a diagnosis that can be made depending on what symptoms the patient actually presents to us. One of the big challenges in treating depression is that the response to treatment, whether it be psychological treatment, medication, or what would normally happen, of course, is a combination of both. The response to that approach is often disappointing. And so that there's a significant proportion of people, a fairly large minority of people, who don't respond very well to that combination of psychological treatment with antidepressant medication. So it's a real challenge at times to get people better. But we usually find that with perseverance and with time, for most people, we actually achieve a good response. If somebody thinks they may have depression, the best course of action is to see their family doctor. Family doctors these days are very skilled at detecting depression and asking the right questions and trying to understand what someone might be going through. They're also the people who are very well equipped to treat depression, particularly in the earlier phases, and before it becomes so severe that psychiatric help is required. So the first port of call should be the general practitioner. From there, the general practitioner may decide to refer them to a psychologist for psychological work, or they may choose to prescribe an antidepressant medication, or they may do both. The combination of psychological treatment and antidepressant medication are the most commonly effective treatments. For the more severe forms of depression, electroconvulsive therapy is a very effective form of treatment. There are other interesting and perhaps more modern forms of stimulating the brain, for example, with magnetic energy, a treatment that's called transcranial magnetic stimulation. Is a treatment that has been explored and found to be quite effective for some forms of depression. So it's a range of treatments ranging from psychological management, lifestyle management, medication, and then brain stimulation in the more severe forms.